down here and as you can see, they're tapping and clapping. We have a couple of the people up, one fellow's out there dancing in his wheelchair, and some of the staff will go and dance with some of the residents in their chairs because they're not able to get up on their feet and dance, but they just love the music and they just clap and tap their toes, and when they're doing that, we know they're having a great time. So.
It's a 14-foot teepee, and it has 13 poles plus two smoke flap poles. Some of these are cedar. If you see a pole like this, there's a crack and it goes in kind of a pole. That's a tamarack. And we got balsam and spruce.
And so there was a brand new family doctor replacing him for the year. So 2 new providers. And that appointment was pretty terrible. So the new resident did not bother to find anything out about me and proceeded to talk to me as if I was an idiot with about a grade 6 level of education. I left, made my next appointment. Went through my 3rd visit and it was just as bad. Towards the end of the visit, he gave me one of those screening forms to fill out to assess my social risk and my need for interventions, which is fine. I think they give that to everybody. And so I read it and I filled it out very quickly. It's just like, do you have reasonable social supports? Yes, no, things like that. And when I finished it and I pushed it back across the table to him, and he said, "You filled that out fast." And I said, "Well, I read fast." No, for real. And then he asked, he could be here, I don't know, I'm not sure I would recognize him. Probably not though. He asked what I did, like for a living, what my work was. And I said, well, I'm a general internist, I do mainly cardiology, but I practice public health as well. And he got visibly nervous, like really scared. So we finished the appointment, and I say, "So can I meet the doctor now?" And he again says, "No, the doctor doesn't need to see you because there's no concerns, no complications." Well, I'd already decided that I was going to ask for my care to be transferred to an obstetrician that I had worked with as a med student, whom I was very comfortable with and was quite convinced I would get the type of culturally safe care that I wanted. There are no bystanders when it comes to racism or cultural safety, kind of like the bullying movement. If you are not part of the solution in providing culturally safe care and a culturally safe workplace, you are part of the problem. There's only two options. So there are no innocent bystanders.
He kind of represents a prairie chicken, and you'll see some of the moves that he does kind of imitates a prairie chicken. And he wears a head roach. Most men dancers wear a head roach and feathers up top, and those feathers that are on top, they represent two warriors fighting. So if you watch his head roach, those two feathers on top might look like two warriors that are dueling.